That certainly has been a part of the considerations here, but as you can hear, much of what's occurring isn't just specific to COVID. It's connected to delayed care, it's connected to the staffing crisis nationally, and it's connected to the behavioral health crisis that we have described. If we had the opportunity to have some of those issues be cared for with that type of hospital setting, we would, but we are limited to the alternate hospital site really focusing on COVID. And that, as you can hear, is not the primary leading issue of our concerns.
Rajat just mentioned immediate steps you may take. What are the immediate steps?
So I'll start and certainly allow others to contribute. The first is this public messaging. We need to ensure that people are educated about what our health systems are facing, the creativity and innovation and patience and determination they're using to address it, but the role that each and every individual can take to help us in addressing this. Making sure you get vaccinated, making sure you're familiar with the non-urgent medical care opportunities you can access through your primary care provider, telemedicine, or our urgent care centers. That's the starting point, because the majority of those who come into the EDs are walk-ins, and being able to ensure that individuals are educated about other steps they can take to avoid having to come to the emergency department and to preserve the ED for those with the true medical emergencies is the critical piece that we want to address, and it's why we're here today. It's a contributing factor that is small in the grand scheme of things. We are at 98% compliance in terms of our vaccination policy, and we implemented this policy actually to help stabilize what is happening with our healthcare workforce. We can be confident that 98% of our healthcare workforce are not going to need to be isolated or quarantined multiple times or disrupt their ability to provide high quality care for patients. So our approach has been part of how to address the issue that we're facing, and all of the other components, what's being seen nationally, is actually contributing to why we're here today.
What is it just burnout, people leaving the industry?
It's a combination. It's a combination. The staffing crisis throughout the nation, and others can certainly add to it, certainly has burnout as a part of it, but it's a challenge everywhere. And so working together to address it is key. Does anyone want to add anything?
I think just highlighting a couple of things that you guys asked. I think number one, we have to have another option, so primary care doctors taking patients that don't need to be in the emergency department. I think what are we doing as a hospital system? I think it's kind of multifactorial. One is we have to recruit more nurses and retain them. That's one, that's a big strategy of ours. Second is we have to be really efficient in the care of the patients in our hospital, so we move them through our hospital very efficiently. So there's a lot of teamwork going on that. I just want to highlight one thing you had asked about vaccine. It is a tiny, tiny portion of our staffing challenge. That is not a big contributing factor. The big issue right now is, our healthcare workers have been working 20 months constantly, and there's a lot of burnout. And from a nursing perspective, this crisis is across the country. And so there's a lot of travel nursing that's happening across the country. People are moving across around, and that's putting more strain on our staffing. So it's burnout. It's other opportunities for nurses to work across the country. Those are all a couple of the reasons. I would say the burnout is equal amongst all healthcare providers, is my opinion. But the staffing crisis is predominantly is heavily in the nursing side right now. Heavily in the nursing side.
Obviously,
Yeah.
more than a year and a half into the COVID situation, I think before you have asked people not to overwhelm emergency, particular emergency, having you do it now. I know case numbers are up a little bit, the hospitalizations have remained relatively flat, but why now doing this? And just to clarify, if someone thinks they have COVID, what should they do? And again, how much of this is COVID related as opposed to other reasons?
Yeah, so it's correct to say that we have expressed this message before, prior to COVID as well. And the why now is just so that everyone can be informed and educated about what's going on in advance of us moving further into the respiratory viral season. Where we are with capacity will only progress in that way without people knowing the opportunity to do something differently. And the education matters. So we're glad that people will take this information and listen and determine the right place to get the right care for them. If someone has symptoms of COVID and they are non-urgent health symptoms, particularly if you have been vaccinated, that significantly helps. There are higher rates of cases, hospitalizations, and subsequent consequences among people who are unvaccinated. So any types of symptoms that are non-urgent health symptoms are ones that can be cared for in the settings that we're talking about. Your primary care provider, urgent care center, and tapping into any of the other possibilities that exist. If you have symptoms that are consistent with the examples that I gave earlier for medical emergency, we want to ensure that our emergency departments are available for you. And the best way to do that is to ensure that people are vaccinated so that they have a significantly lower risk of having to go to the hospital, and that you know the other possibilities you can take if you have a non-urgent health issue to address.
How do you want to address the non-speaking community? Do you have any plans for that?
Yes, absolutely. As a part of this education campaign, we want to ensure that we have multiple languages. We want to engage the communities that are impacted to help us in getting the message out. Everyone hearing this message now serves as an ambassador for those who have not, or those who may not have had access to what we are saying. Everyone can do their part in continuing to ensure, in the proper language, with the proper understanding, that people should get care in the right place and in the right setting.
Doctor, I know that we're hearing a lot about workforce development programs. We hear them at Lifespan, we hear them at Tournament Link, but this is a statewide issue at this point. Do we need a statewide solution to get more staff workers in clinical settings, whether it be hospitals or clinics?
We absolutely do. This is a all hands-on approach across all the partners here, and James Jot's comments about using a systems solution approach to a systems issue is exactly what we are advancing with now.
This may be a little down the road, but since the emergent talks are coming along, will that create more opportunities for people to seek care or consolidation in less places for people in Rhode Island?
It's a great question. Does anyone want to give your thoughts?
Yeah, I mean, I think if anything, it'll maximize our ability to care for patients. But again, this is right now we're in a crisis. I think the merger talks have, we got to get through this crisis aspect of patient care now. But reality is, I think it'll give us more opportunity to care for our patients.
How exactly?
Yeah, I mean, I think it's around, different primary care settings and making sure that we have, good spread of our practices across. And there's others, but I probably shouldn't get into that here in that setting.
I guess is the vision that merge operations
I-
and cut staff and consolidate operations?
Again, this is about the health, the crisis that we're kind of dealing with now. I think we're still going. I'd probably stay away from having discussions on that here.
Time for one more question.
Yeah.
Anyone else?
Sure. So it's a great question. We have found that if anything, people who are coming into the emergency department are sicker than they were before the pandemic. Um, while we are seeing actually in many cases fewer patients, it's harder to see them just because of our strains and capacity. But overall, the admission rates in in the hospitals that we're following, those admission rates are going up, signifying that we have people who are still coming to the emergency department for needed care, and that I think is great news. I wanted to return. You had asked what I thought was a great question as to what should people do if they're concerned that they have COVID, and I think a lot of it really, as Director Alexander Scott had said, a lot of it depends on your symptoms. If you have a cough, if you have a fever, if you have a headache, but you don't feel particularly sick, there are a lot of community testing sites that you can take advantage of. You don't need to come to the emergency department. For many people, particularly younger people, people who've been vaccinated, a lot of times we'll make a diagnosis of COVID in the emergency department and we'll discharge patients home because they're not sick enough to be in the hospital. That having been said, for patients who really feel sick, we will always be there for you, but it's COVID. Obviously, COVID can be really scary, but not everyone who has COVID will need to come into the hospital, and not everyone who thinks that they have COVID will need to come to the emergency department for testing.